This is Dr. John Bergman for the Doctor's 4 Minutes. Last patient had a conversation that was incredible. Now here, this father who loves his daughter is 17 years old. Yes, she was born in an American hospital with all the vaccines and all the procedures given to the mom during the birth process. Currently, she's taking 2 antacids, 2 antidepressants, 3 asthma drugs. Now the doctor said, where is the animosity coming from between medical system and the chiropractic world? Why do you guys not like each other? I think that was important, and I told him, I said, there's not an animosity. I'm looking at this child here who's 17 years old, and she's taking 2 antidepressants, one a benzodiazepine and the other a selective serotonin reuptake inhibitor. Both of those have warnings on them. The SSRI says it has the risk of suicide, suicidality, and suicidal thoughts. There is no science to say a 17-year-old should be on 2 antidepressants. There is no science that shows that the antidepressants with the antacids, with the asthma drugs, are going to be effective or positive for her. Now, she's seeing me shaking, she can't stand it, she's anxious, she can't sleep, all of these signs. I got a problem with the medical system that's prescribing these drugs that aren't based in science, and they're telling the parents it is. Now, we're going to be able to help her by giving her omega-3s. We're going to get her nervous system working correctly. I'm going to teach her how to get deep sleep. Getting her off of the drugs is the hardest part, because I've got to work with these doctors and say, hey, look, she didn't have a drug deficiency, she had a neurotoxicity effect. Her body has been inundated with about 60 doses of 16 different vaccines over 17 and a half years. This is incredible. It's 3 times more of the toxicities or vaccines that any other country gives, and we have the sickest kids, and this is the result of it. I don't have a problem with science or medical system. I do if they're not doing it based in science. There's no validity to giving a child 7 different drugs, and the side effects of them are incredible. Headaches, dizziness, nausea, suicide, suicidality, suicidal thoughts. It's nuts. And yes, her diet sucks too. And I'm looking at an x-ray showing a leaky gut. All of this is the result of the doctors that this parent respects because he has no other alternative. We have to start getting charge of our health, not abdicating authority to a system that's not based in science and not based in health. The old days, you would pay your doctor if you felt better. That means he was doing his job. You would stop paying them if they weren't doing their job, if you felt crappy. This medical intervention in this child is dangerous, ineffective, and not based in science. Parents, start rethinking this process. Take charge of your health. Kids, look at this. Look for the solution. Her body, just like yours and mine, is naturally healthy. To fight disease doesn't exist. This disease that this child is suffering from is from deficiency or toxicity. And not only is it not helped by medications, it's actually harmed by them. Doctors, rethink this protocol. Utilize omega-3s for the brain function. If you have curiosity on this, there's a brilliant book called Phospholipids in Neuropsychiatry, or Lipid Therapy in Neuropsychiatry. You have to look at the real cause to fix the gut, get the kid to sleep right, get appropriate nutrients. Thank you. I had to vent. Your body is naturally healthy. Please, this is Dr. John Bergman. Doctors, if you do not get this, call me. Until we start doing antibody tests on the vaccines, you have to stop those. Nobody needs 6 DPT shots. 6 times 3, baby, that's 18 shots right there, and we're doing that before they're 6. Rethink this protocol. Your body is naturally healthy. This is Dr. John Bergman. God bless you.